Hello, everyone. I see we have folks joining in. So as you're joining in, please take a moment to introduce yourselves in the chat, your name, where you're joining from, what's your organization, and then we'll get started. We'll give ourselves another minute, and we'll then get started today. Thank you so much, and welcome, everyone, and thank you for joining us on this special day today, where we are launching Flourishing Children, Healthy Communities, and a Stronger Nation, the U.S. Early Years Climate Action Plan. We are here joined by our Early Years Climate Action Task Force members. And today, what I will do is just give you a little bit of insights on how we really came across this plan, how it was formulated. And then, of course, we'll hear from our wonderful task force members in what stood out for them and what do they see as moving forward as next steps, so that we can really make this action plan actionable. So I'm going to talk a little bit about why we're talking about young children and early years and families. So if we can go to the next slide. The first thing that, for me, personally has been that at Capita, we've been working at this idea of human flourishing, of young children and families flourishing. And specifically, when we look at it in the context of climate, what we realize is that climate change will most negatively impact children's health and their well-being. In fact, it's not only something that will negatively impact, we're seeing this day-to-day negatively impacting children and families. Even if I look at my own personal lived experiences in the last 4 months, from poor air quality days to dealing with extreme heat, to flooding recently in New York City, where I'm based. These are day-to-day interruptions that prevent us from actually leading lives that we can with young children and families, whether it's actually taking children out to play, to actually thinking of their health, whether it's with bad air pollution or even heat. So these aspects, of course, impact children most significantly. But we also realize that there's an opportunity in promoting healthy and resilient development for young children, which can actually better enable the society to both tackle climate challenges, but also lead a more healthy and a resilient being. And with that thinking in mind, we launched the Early Years Climate Action Task Force along with Planet Ed at the Aspen Institute. And really the idea started with first listening to what's happening in the field. If we can go to slide 4, Michael, that talks a little bit about our past year. And in the past year, we held over 6 listening sessions that brought people together from across the country, from childcare providers to pediatricians to parents to community members, to really speak about how climate change will impact young children and also what they're seeing in their day-to-day lives as the effects of extreme weather events. So, we, from the stories that we heard, which were, of course, a little, disturbing, from how childcare clinics, childcare centers and clinics are handling, how they're dealing with whether it's wildfire or extreme heat when their HVAC systems break down. But we also heard some stories of hope and some bright spots, which the action plan also covers, which makes us feel that there is, of course, it's not just the end, but more of what we can do now in coming together. And just to give you a little bit of an overview of the type of listening sessions and the themes that we had, we'll go to the next slide that shares the range of listening sessions. So, from what communities, what type of investments we can have to state, local, and national plans that already exist. Also, just understanding how cities and infrastructural systems can do better. So this gives you an idea of the type of listening sessions that we held. And for us, the key messages that stood out, which, are these 3, which is one, that we don't think that climate change is a separate issue. And, through these listening sessions, it became very evident that it's not about asking whether it's a healthcare center or a childcare provider to take on climate change as an issue that they need to address. But it is the context in which we are currently operating. It is a context that we need to keep in mind as we keep tackling challenges that already exist. The second part of it is that, recognizing that healthy, resilient children and families are the foundation for healthy, resilient communities. And that the action plan really sets out opportunities for today as well as what we can do in future. And the way the action plan as framework is set up is really centering children and families along with child and friendly facing programs. And then the next level with local communities. And then, of course, the changing climate. And if Michael, if we can go to slide 8, which talks about just the action plan recommendations, you'll see that the action plan not only talks about what just the federal level can do, but the state level, local communities, what the business sector can do, what the private, what the philanthropic sector can do, what the nonprofit sector can do. So it really, the research sector can do. So it really brings in different sectors and perspectives that they can put forward. Just to give you a little bit of a flavor of what these recommendations look like, I obviously won't go over all the 50 recommendations, but for example, it talks about federal policymakers, how they can consider policies that will impact children and future generations by using existing programs, but also leveraging cross-agency leadership and public platforms to advance these solutions. So whether it's the Child Care and Development Block Grant or Medicaid or Inflation Reduction Act, really using what's available and integrate the needs of young children and families into it. For states, there's a recommendation around implementing programs that supports expecting parents and caregivers so they have resources and tools to promote healthy child development in this changing climate. I know, Elizabeth, you might talk a little bit about that later. And then, of course, local communities, they can ensure playgrounds have sufficient shade and safe and sustainable spaces, supporting early year providers to upgrade their facilities. Angie today will talk a little bit about her work, which kind of covers on that and how we can better equip the providers and the service to work better. Of course, the business community, how they can create more climate aware policies and programs for employees with young children, to even philanthropy and how they can develop a regular national scorecard on the state of young children and climate change. With researchers, it gives recommendations on what type of research is needed, whether it's on communicating with young children and family and their parents, or just coming up with the actual impacts on 0 to 3, where we know that the biology is significantly different in other ages. So it really does bring in all these different sectors and shares ways that they can actually do their bit, but also just integrate with what they're already doing. So that hopefully gives all of you a little bit of an overview. I would definitely encourage you to check out the Scrolly site, which we'll share in the chat shortly, that will, of course, be the access to the plan, and hopefully you can download it and read it and share it amongst others. But what I'm most excited about for today is to actually hear from the task force members. So we're joined with Elizabeth Picchard from Moms Clean Air Force. We have Angie Garling from the Low Income Investment Fund, and we have Alicia Musu from the Oglala Sioux tribe. And what I will do is just turn it over to these 3 amazing task force members and get you all started with the first question, which is, as I mentioned, there were 6 listening sessions. We heard a lot of stories. A lot of people share perspectives from both their professional and personal lives that sit at the intersection of young children and families and the changing climate. What is one story that stood out for you, or that really has been something that has stayed with you as you've been working in not only getting the recommendations out, but also in your day-to-day work? And maybe Angie, we can start with you, and then Alicia, and then Elizabeth. So Angie.
Great, thank you, Ankita. So I'm Angie with the Low Income Investment Fund. We are a community development financial institution that works to put children and families at the center of how we design and build communities, because we believe that if we do that, all of our communities will thrive. And I come at this from a parent, as a parent as well as a professional who's worked in the early care and education sector for over 25 years. And one of the stories I heard was also one of my personal stories. And then we also had a testimony from child care provider operates about 15 child care programs in Northern California, and they were affected by the fires in Sonoma County, having to either shut down because of active fires or shut down because of bad air days. And just first of all, about like the physical infrastructure that they had or didn't have that enabled them to respond or not respond, and how important the intersection of the built environment, early care and education, and climate emergencies is to making sure that our children are safe, and the women, mostly women who do this work, are thriving and have the resources they need to make sure that they can take care of and nurture children. The second one was when I was on a site visit along with one of my colleagues, a couple of my colleagues in the Coachella Valley of California, just one of many areas that is already hot and getting hotter by the year. And it was in the summer and it was 106 degrees and no children could be outside because it was just too hot. And childcare facilities are just not designed for children to be in them all day long without ever going outside. So what do we need to do differently if there's not enough tree cover for shade? Children can't touch the tricycles. They can't touch the play structure. They can't even touch the railing to go to the play structure. And luckily they had air conditioning, but they were stuck inside all day long. So what are we doing to support our children, protect our children, and make sure that they have good, healthy spaces to be inside and outside, to ensure that they can, weather these, climate emergencies and, our warming temperatures. That's what struck me.
So my name is Alicia Musso. I'm the vice president for the Oglala Sioux tribe. We are a large land-based tribe, and we're one of the largest tribes. We have 54,000 enrolled members, and we're based in the southwest corner of South Dakota. I think what struck me most about the stories, and mine is more like thinking about all the stories together, and the thing that kind of stuck out to me is that how do you prepare for something when it's something people have never experienced before? And I think, we're used to things and preparing for things we're used to, but the climate and environment is changing so much that many of our people told stories about just not being prepared. And how do you prepare for something that you've never experienced? And so, tribal communities have always adapted to things that we've never experienced before in our history. And we've also experienced funding and supports not always being there for that shift and for people to adapt easily. So, my hearts went out to all of the stories that we heard, because it is hard for us to understand things that we've never experienced. But now that we're experiencing them, how do we respond? How do we adapt? What are our values that we put at the forefront whenever we are adapting and changing? And I think putting our children at the forefront of everything we do, especially in this changing environment and climate, should be at the top of our values and what we put our resources to. So that is something that I notice very broadly and across stories is experiencing things we've never experienced before, adapting and trying to find resources, and so that we can plan and prepare and continue to move forward together, especially taking care of our children at the forefront.
Thank you, Angie and Alicia. My name is Elizabeth Bayshard. I'm a senior policy analyst with Moms Clean Air Force. We're an organization of over 1.5 million parents and caregivers around the country who are mobilizing to try to act on climate change and air pollution for our children's health. And I'm also a mother of young children. And the stories that stood out the most to me were those that talked about the impact of climate change on the health of babies and pregnant people. These stories are hard to take in. And many of them touched on how climate impacts like extreme heat, air pollution, wildfire smoke can affect the health of babies and children before they're even born, and are linked to adverse birth outcomes like preterm birth, low birth weight, even stillbirth. And of course, there are tremendous health disparities in these outcomes, and women of color are, much more likely to experience these outcomes than white women. One of the stories that stood out to me was with a speaker who was a doula. I believe her name was Malika Ludman from the Birthmark Doula Collective in New Orleans, which is, as we all know, an area that's been deeply affected by hurricanes and strong storms and will continue to be so. And she was describing how when there are these strong storms, infant feeding can be disrupted. So parents with new babies may struggle to quite literally feed their children, when there's a strong storm. And I was really inspired by an initiative that her doula collective has put together. I believe it's called Infant Ready, where they distribute infant feeding kits to families with new babies or pregnant families who are expecting new babies, so that if there is a climate disruption, they will quite literally have the tools they need to feed their babies. And as heartbreaking as many of the stories that we heard were and are, it's also inspiring to hear stories of creative, solutions that we can do, like handing out feeding kits to families with new babies. We can do that, right? So I was really inspired by these practical ideas that emerged from the listening sessions as well.
Thank you, Elizabeth. And I think that, this afternoon we also heard from other. We're in DC with the launch. We had a lunch and we heard from other task force members too. And I think it's really interesting how for each task force member, there's a different story that stands out. But what the fact that it stays with us, that moves us, but it also helps us realize that in the end, like when we're talking about climate, we are really talking about people. And it's to center the needs of people. And I think the climate language for so long has been, much broader than that. There's a lot of technology conversations. It's all big picture, but in the end, it's impacting lives. It's impacting young children and families. Elizabeth, when we spoke last, you talked a little bit about something that happened recently in your community where a parent, the fact that, when you talk about people getting impacted, it's actually also community members that sometimes step up. Can you share that example and also relate it to how some of the recommendations in the action plan are trying to kind of like ensure or safeguard that these situations are either recognized or are given the space, or we recognize that this is happening. So I'm going to stop and let you share the story that you shared with me.
Yeah, sure. This was a story from this past summer in Vermont. I think probably everybody remembers the week of headlines from the flooding in Vermont. I live in a community that was very much affected by that. Many communities in Vermont are fairly rural, fairly small. And in the community just next to mine, a good friend of mine lives, and her community was literally underwater. I mean, her road was cut off. They couldn't drink the water in their town. And my friend was trying to figure out what was, going on in terms of the emergency response in her town. And she went on Facebook and, put up a Google Doc and found out that within a few hours, she was in charge of the town's relief effort because nobody else had stepped up to do the job. And I remember her telling me a few days later, after the flooding had receded a little bit, that she who creates the spreadsheet is in charge, apparently. And so she was literally, coordinating whose basement needed to be pumped out and who needed diapers and who needed water because the whole town was under a boil water notice, and who needed and could provide childcare because nobody else had stepped up. And she told me afterwards that the town manager started to come to her for advice because they didn't know what to do, and she seemed to be competent. And this reminded me of an idea that came up in our listening sessions and with the recommendations of the task force for community resilience hubs that can help us respond more proactively to disasters. And in the wake of a disaster like a flood or a wildfire, to make sure that there are mental health supports in place, like proactively to help support community members. I mean, my friend was telling me about how, for much of her sort of volunteer time, she really hadn't planned for after this flood, people just showed up because they needed to talk and didn't have anybody else to talk to, and were just, grieving. And, she did an amazing job. I don't want to, undercut her efforts, but there could have been a plan for this, because this will happen again in communities around the country. And so I'm excited to see recommendations for stronger community hubs where we can sort of plan in advance for the kinds of social interactions and mutual aid, exchanges that we want to have with our neighbors, not if, but when these disasters strike. It will really, I think, improve mental health in recovering from these disasters too.
Yeah, thanks, Elizabeth. And this gives me goosebumps, because I'm just thinking of the amount of effort and labor that we often put in, even when we're not really responsible for it. And I think I joked, I said, she who makes the spreadsheet does all the work, is basically a story of a lot of women's life at work too. So just tagging that too, the unseen labor and the effort that we go through. But talking about community resilience networks, I do want to turn to Angie. In one of the listening sessions, we also heard from how there's service providers and childcare centers that have acted in the past as these resilience hubs, because they are connected to the communities that are living there. They know what's going on. Sometimes they are actually even the ones taking on the effort to communicate with parents, to inform them of what's happening. And in your work, Angie, you work a lot with service providers, and you also work with the infrastructure that they have to upgrade. And a lot of the family, I mean, I've seen pictures that, how certain family care, childcare providers, you've helped them upgrade their spaces to just make them more resilient. But this is happening more and more. And how much can you really help with the funds that you have? So maybe if you can talk a little bit about what you're seeing in your work, the financial aspect of where are possibilities. And I think the plan talks about that. So if you can shed light on those aspects and from your perspective.
Yeah, sure. And I really appreciate how the task force recommendations do have a section that really talks about the built environment. And, as a financial institution, we're really excited to work with our colleagues on helping to, move these recommendations forward on the built environment. So yeah, LIF, our organization across the country in different geographies, has around 5,000 to 6,000 providers to whom we have given grants, usually originally from government agencies. And we do often prioritize programs that have been impacted by natural disasters. As climate is not necessarily, climate effects with natural disasters are not always, those are prioritized, but things like shade structures. So we've put up a lot of shade structures and to help provide more shade so it's not as hot when kids are outside. And we're also working with a climate consultant in California, but hope to bring this out to our other geographies to help advise us so we can advise our grantees on using Energy Star appliances, installing, instead of having fossil fuel burning appliances, but having a heat pump instead of, regular air conditioning. So how can we, putting solar panels on. So how can we make sure that the actual physical built environment is resilient? So I think that is really important, and those recommendations in the task force recommendations are great. And then also how, as Elizabeth said, how can we ensure that childcare programs, which just naturally have contact with parents or their guardians twice a day at drop off and pickup, which is more often than they go to the doctor or they see the doctor or see a lot of other health and social service professionals. So we naturally are in touch with parents and can serve often as that community hub, but many of our programs are not on the list, right? They would have to go on Facebook and put together a spreadsheet to actually be seen as that community hub. So how can our sector be more integrated into the government emergency response infrastructure and really center those programs as the community resources that they are?
Thanks, Angie. Alicia, maybe if you can elaborate a little bit more from your perspective, because I think what you started with was like, you know, um, your community's always been adapting, and now you're facing something that actually no one is prepared for. One of the stories that Antoine, who chairs the task force, shared today was about food and how there is a conversation around, you know, especially in indigenous people in communities there. And he shared the story about, like, you know, moving from actually healthy food, what we considered fish, to now thinking of processed foods because the food systems are even getting impacted. So I'm curious, from your perspective, what are some recommendations that you see in the action plan that safeguards and helps prepare us for what's to come?
Yeah, so food is, right, is medicine. Food is medicine for all of us. And, you know, many of our tribes in the Northern Plains use buffalo as our traditional source. And they're our relatives, and we've learned many things from them and observing them. But as we've seen, there was a major, you know, eradication of buffalo. The herds were, you know, dwindled down to like 300 to 500 buffalo, right? And so that resurgence of bringing back those natural animals and natural plants to our environments are so important for climate and for us as people to continue to get the food that we need that is medicine for us. I believe a Kansas State research studies saw that, you know, reintroducing buffalo increased the biodiversity like exponentially, significantly. And so I think bringing back those natural foods to the areas, plants, animals, is going to have an impact on the people as well, obviously. I mean, everything is connected, right? And many tribal communities, especially the rural tribal communities, become food deserts. But we still have a number of people in our communities who go out and you know, they gather, you know, the traditional plants and medicines and food in the area, and we still use those in our communities. So I think we just still have a lot to, you know, learn from our indigenous people about those foods and how to bring them back. And, you know, not people didn't waste food either, right? When you naturally gathered them and naturally brought them and harvested them. So, you know, the buffalo was used for food, shelter, clothing, you know, utensils, weapons, things like that. So even going back to those things and appreciating the food that we eat in those types of ways is going to go a long way for our children too, moving forward and understanding how to get that food in their natural environment. But, you know, it's just returning to those ways of knowing and being really connected with our environment as well, so that we can continue to take care of it, and it'll continue to take care of us as well.
Thanks, Alicia. Is there one recommendation that you feel, actually, wait, before I ask this question to everyone, I also want to just point out to our audience that if you have questions, it's time to think about them and put them together, because we'll quickly move on to all of your questions. But while you're thinking about that, my one question for all of you, Alicia, Angie, and Elizabeth, is there one recommendation? And I know we don't need to play favorites, but one recommendation that stands out for you from the action plan that gives you hope or makes you feel a little more excited. And I know you already touched on a few. Angie, you touched on a few. Elizabeth, you touched on a few. But maybe Alicia, you can start with one that stands out for you, and then we'll go to maybe Elizabeth and then Angie.
I think the ones that really stood out for me, you know, I work in tribal government and understand policies, and we can make our own laws as tribal nations for our communities, and we do, that are culturally specific and contextually specific. Those are some of the, you know, most effective laws when you incorporate your context and are specific to the cultural and, you know, language and all those pieces that are important to the people who you're serving. But I think the ones that really stood out for me were the local on the ground, you know, actions that we provided, because it's one thing to make policy, and I think those really help guide and help our communities be, you know, choose a path of more healthier lifestyle. But those on the ground people who do the work, who have the checklists that we talked about, who are checking on people, who are helping, you know, help people get the water out of their basement, helping people get evacuated from their homes. Those on the ground, recommendations were the ones that really resonated with me, because I'm sure everyone on this panel has been a hold of a checklist before and have gone out and done those on the ground things. And those make all the difference in the world, that follow through and that connection with your community. So those ones that were more on the ground and specifics, those are the ones that really resonated with me, because I think all of us have, a role and responsibility in putting forth this information, but following through and doing it in our own lives for our communities and with our communities.
I completely agree with that, Alicia, that I'm really moved by the recommendations that encourage just community resilience in any way. But there was one particular recommendation that especially resonated with me personally. It was a call to increase mental health support for young children and their caregivers, their families. Some of you may have seen a report that was released yesterday from Eco America on the impacts of climate change on children and youth mental health. It's a great companion to our early years piece, and painful to read, as we heard many times in the development of this action plan, that, climate change affects young children's mental health, whether it's from the stress and trauma of living through a wildfire, a hurricane, or the physiological impacts of heat and unhealthy air. And we know as well that, the psychological well-being of parents has a huge influence on how young children cope during climate stresses too. And I think anybody who's been caring for young children over the last few years, who has experienced climate stressors, like the days, when it's not safe to let your kids go outside and play because it's quite literally too hot, or the air is too smoky, or you have to evacuate with a kid who's still in diapers. I mean, these are profoundly stressful events for families, and traumatic and stressful for young children as well. And so increasing mental health support for these families is going to have a huge impact on the well-being and resilience of these children and their parents for years to come. So that's a recommendation that I would really like to see carried out in the world.
Thanks, Elizabeth. And Angie, before you go, I just want to point out that the two things that in the chat that have come up, and Maria Isabel, she talks about something very similar, which is the changes in the environment limiting the outdoor space, and how programs often don't have enough space or playgrounds for children. That is resilient. So I think there's that connection. And Angie, this relates back to the work that you're doing too. And to your point, Alicia, there's something really beautiful that Nancy Just has written, which is giving us the opportunity to teach our children the love and care for Mother Earth, and hopefully they will be better stewards of her than we have been. And I think this is, again, giving me goosebumps today, that there is this relationship with our environment, the food, the way we live, that also teaches us to respect and love what's providing for us and what has provided for us. So I just wanted to point those two thoughts out before we move forward and we see more questions in. Angie, if you can share yours, and I encourage everyone in the audience to please share comments, thoughts, questions, whatever you like. We'd really like to incorporate that in the discussion too.
Wonderful. Yeah, thank you. And I appreciate what Elizabeth and Alicia had to say on their recommendations. And no surprise, the ones that resonated the most with me are really around the built environment. And, every new early care and education program, whether it's a home or a center, should have the most low carbon, carbon neutral, best quality materials where it's being built that reduce our carbon footprint. Those programs should be prioritized in any of the climate funding that is being rolled out through the Greenhouse Gas Reduction Fund or the infrastructure bill, because, and I feel like the task force recommendations did a really good job in the framing part of talking about how the health impacts on young children and the health impacts on Black and Brown communities and how they're disproportionately impacted. I think that's really important. I think the document does a good job of talking about that. And I really feel like we need to push on the climate decision makers on how they are distributing resources to make sure that early care and education and early childhood is top on their list because of those reasons. Also, another thing that struck me was that programs, where people have to take their children when they go to work should not be really far away. Like we should have co-located, closely accessible early care and education programs, whether they're, a home-based program or a center-based program. So families don't have to travel so far, get in their cars, drive up and down the highway or down that rural road. And that can also be something in terms of how we plan our communities. How are we planning them better to think about the needs of children and families to make it easier for them? And then the last thing is thinking about those women, many women of color who are doing this work every day, who are taking on that additional stress and that additional burden, and sometimes not working in a setting that is as resilient or healthy as it could be or should be. And how can we make sure that we're prioritizing their welfare and their working conditions by making sure that the built environment is quality and safe for them?
Thank you for that, Angie. And I'm glad you covered built environment, because that's also something that I'm particularly very interested in. I'd like to give the audience a chance, if you have questions, to please type that in. But if not, I have one more. So I'll give us a few seconds to see if there are any questions from our participants. I do see one comment from Matthew Tinsley. And, he talks about how can we better connect the early year education system to public health for better heat, air quality management, emergency management, etc. And I'm just going to base that question, basing my question off of that, also thinking of everyone who's in the audience. If you were to talk to someone who says, actually climate and young children in early childhood is not connected, what would you tell them now that we have this action plan? Maybe we can start with Alicia, and then Angie, and then Elizabeth, and then we have one more question. I'll ask that, and maybe you can answer both of them together. And then the other question that we have is, what is the role of advocacy in moving these recommendations forward? So I think those kind of connect with each other. Maybe if we can start with, what would you tell someone who says these are not connected, and how do you see the role of advocacy in moving these along? And then after that, we'll wrap up because we're almost at time. So Alicia, Elizabeth, and Angie. Yeah, I guess that's the order we'll do.
So I missed the second part. What's the role of
advocacy in
advocacy?
Making
Gotcha. Yeah. Okay. And moving it forward. Well, I mean, tribal communities believe everything is connected. We have a saying in our community, it's Mitakuye Ayase. It means we're all related, right? Trees, rocks, everything has a spirit. So and we know that, right? We know whenever we start to see a problem, when we start to find solutions for it, it's never just an easy solution. Everything is connected, right? Like you can't just get a house and say, oh, we have housing, so it's fixed, right? How do you make that house a home? You need infrastructure, you need all the pieces. And in our community, I mentioned that the buffalo are relatives, and we've learned from our natural environment, observed, and so, and I talked earlier about values, right? Putting our children at the center of our values. And when we think of our buffalo relatives, they taught us a lot. And one thing they do is, when there's danger, they will circle from the strongest on the outside and the most vulnerable on the inside. The most vulnerable are usually children and elders. And so if we always put the children at the center of all that we do, we're all involved in that. That's all of our roles and responsibilities. So if we're not helping families and children, we're not helping anyone, because that's all of our roles and responsibilities, is to take care of our most vulnerable but most sacred, right? And our children are the most sacred. They're very innocent, very, they still rely on us to take care of them, and they're very sacred. So if we can figure out our values. And, you know, I think advocates understand that, right? That's why they're advocates. They're advocating for the most vulnerable, the most sacred. So we maintain those values and put them in the center of all we do. So I think, you know, I don't think anything can be, everything is connected. It's not set, nothing is separate. We all impact each other's lives and our, you know, whether we know it or not, we're all, you know, anything we do is having multiple ripple effects in our communities, and our children and families are always impacted by that. So if we're not taking care of our children and families, then, you know, we're not taking care of ourselves or anything else. So, but I think advocates get that. I think advocates understand that. And it's just figuring out what our values are and using those to guide us. And, you know, our children and families should be at the center of our values.
So beautiful. Angie.
Yeah, thank you. You said it so well, Alicia. I really appreciate it. And I think I was reading some of the things in the chat too. And, you know, there are a lot. So the recommendations are just the logistics piece. The recommendations are divided into like recommendations around children and families serving institutions and communities. And we had actually originally thought about recommending it in different, like local advocacy, state advocacy, and federal advocacy. So I thought just making our thinking transparent to those of you on the webinar may be helpful, because we need advocacy at all of those levels. Like it comes down to like community meetings, and, you know, if there's you know, a local disaster or climate resources coming to a local community, climate resources that may not immediately prioritize early care and education. Well, we need those children and families and those children and family serving institutions to be at those community meetings to make sure that the elected officials are listening and prioritizing funding for young children when they are planting trees or doing, you know, carbon offsets or you know, whatever they're doing that is helping to implement some of these climate resources. I mean, one of the biggest federal bills that's been passed in recent history that has funding attached to it is focused on climate resiliency and climate mitigation. So we need to make sure that, you know, these recommendations get to those folks, which is all the way at the federal level, as well as states, financial institutions, and at the local level. So I feel like we need a group of federal advocates, state advocates, and then local advocates that, you know, are made up of children and families and early care and education folks at all levels to make sure we're doing this advocacy.
Yeah, I completely agree, Angie and Alicia. And, you know, to anybody who asks about the connection between early childhood and climate change, I would invite them to spend time with a family that is caring for young children during a heat wave or a wildfire smoke event, or when there is, you know, a hurricane or a strong storm coming. I think the connection is immediately clear when these sort of extreme weather events quite literally affect the day-to-day activities of raising children. I think every parent more and more is sort of understanding this connection in a deeply embodied way. In terms of the role of advocacy, I completely agree with what's already been said. And I would add that I would hope that we can really broaden our definition of advocacy to be inclusive in such a way that anybody could see themselves as an advocate. I think sort of words like advocacy and activism can be intimidating, and maybe we have a preconceived idea that it means like going to the White House and or, you know, standing at a climate march, and all of that is great and important and necessary. At Mom's Clean Air Force, sometimes we talk about nap time activism, where, you know, a parent who has a 2-year-old who is sleeping can pick up the phone and call their representative and say, hey, I care about climate change. And anybody can do that. Anybody can make a spreadsheet, right? And talk to their community members and say, hey, what are we going to do? Like the next time there's, you know, a flood, right? How are we going to share resources? So thinking about advocacy in a broader way so that it's less intimidating, I think can really help more people get on board, because as I think has been already mentioned, we need everybody on board, and we need advocacy at all levels to really make the changes that we need to see.
And Elizabeth, I couldn't think of anyone else better than you to answer this question, who, herself represents the advocacy of anyone being able to do that. We are at time, and I'm really the comments in the chat have been really interesting, and I know there are more questions that we don't have the time to answer right now, but maybe we'll get back to all of you via email and have our panelists answer those questions. I do want to share that this is just the start of many things that are to come. Today is just a midpoint, as we like to call it. We do have some more sessions coming up. We have another event next week with Representative Jennifer McCallum, who was also part of the Early Years Climate Action Task Force. And I do encourage all of you to join and keep in touch. If you are working at this intersection, if you need more information, please reach out to me or anyone at Capita. And also, of course, our Early Years Climate Action Task Force. And I will end with this, that, as we're thinking of children and putting them at the center, and I think this is a theme that has been discussed again and again, it really does come down to the fact that we are working in a context of climate change and meeting and starting with our youngest. I think what Alicia, you mentioned, like, protecting them and then kind of learning from the buffalo is so beautiful. The fact that, if we center and create a healthy, resilient childhood and families, we're creating a healthy, resilient society and really thinking of a future that we can have. And really, I think what I'm really excited about is how this action plan gives us hope and covers these bright spots. It's not just doom and gloom. Being able to do something is probably the biggest hope that we have. So I'm really excited to and I want to thank all of you, Elizabeth, Angie, and Alicia, for joining us today, and all our audience for not giving up hope and working at this intersection. So thank you so much for joining us, and onward and forward. Thank you so much.